Next we're going to perform the inspection and examination of the heart. Jason, can I examine your heart?
Sure.
Okay. The first thing that we do is a visual inspection of the chest, looking for any obvious pulsations. We also inspect the neck for any kind of jugular venous distension or pulsations. The next thing that we do is palpation. And this we do with the pads of our fingers, palpating over the different areas of the heart. First the aortic area, next the pulmonic area, the tricuspid area, and finally the mitral area. And this we're doing also feeling for any kind of pulsation or heave or thrill. Next, assessing for thrill, we use the base of our hand, holding it over the lower left sternal border where the right ventricle would be, assessing for any kind of heave. Then we move it over here towards the left side of the chest, over the area of the left ventricle, assessing for heave. Also remembering that over here on the left side of the chest, we're examining for the point of maximum impulse. Okay, finally we do an auscultation of the chest with the stethoscope. This we do initially in the aortic area, the upper aspect of the right sternal border, then the upper aspect of the left sternal border or the pulmonic area, the tricuspid area of the inferior aspect of the left sternal border, and then the mitral area. If a murmur is appreciated, it can also be followed. That is, listening up here in the neck for any kind of radiation of the murmur to the neck, also assessing for bruits. Also, if you could lift your arm, Jason, here, listening for any kind of radiation of a murmur into the axilla. Good. Next, we'll perform an examination with the patient lying down. If you could just lie down for me, Jason, we're going to do the same thing. The second part of the heart examination is with the patient lying down. Visual inspection has already been performed. Next, I will palpate lightly, again in the areas of the chest, aortic, pulmonic, tricuspid, and mitral, feeling for any pulsations. An assessment of the carotid arteries is also a good idea. Lightly with your fingers, medial to the aspect of the sternocleidomastoid muscles, looking for JVD. An assessment of JVP can also be made at this point with the patient at a 30-degree angle. Heave can also be assessed at this point also with the heel of the hand over the right ventricle and then again over the left ventricle. Next, auscultation of the chest in the same manner as we did with the patient sitting over the aortic area, using the diaphragm, pulmonic area, tricuspid, and mitral. Again, if any murmurs are auscultated, you can follow these to the neck or the axilla. Next, I'm going to have Jason, if you could please roll to your left side. Using the bell of the stethoscope, which helps us assess lower sounds, I'm going to place the bell over the mitral area, listening for the low diastolic murmur of mitral stenosis. If you could just move your arm out for me, please. Excellent. Lightly place the bell on the chest and assess the patient in this position. This concludes the heart examination.